A new study by ProPublica shows after the Texas near total abortion ban went into effect, pregnancy became more dangerous for women across the state, and much of that danger is the result of women developing sepsis during pregnancy. Lizzie Presser, a reporter for ProPublica, is following the issue. She's joining us now to talk about what she's learned. Lizzie, thank you for your time.
Thanks so much for having me.
I want you to walk us through the data you uncovered about sepsis rates in Texas.
So we purchased 7 years of hospital data from the state of Texas and tried to understand how are complications in pregnancy loss changing since SB 8 actually, and also the ban in 2022. And we looked deeply into infections. And what we saw was that if we were to look specifically at the second trimester, looking at women who are hospitalized while they're experiencing a pregnancy loss, whether that's a miscarriage or a live birth or a stillbirth before fetal viability, the rates of sepsis really rocketed, about 50%. They held steady at around 3% of cases before 2021. And from there, you can see in some of our data, the rate ticks way up to about 4.9%. So what this is showing us is that there is a statewide trend, not an isolated trend in some hospitals with some doctors, but a statewide trend where what doctors say when they look at this is that the suggestion is that doctors are delaying potentially life-saving care, which is leading to more infection and more life-threatening sepsis.
And so let's dive a little bit more into that. Talk to us about how women typically contract sepsis in pregnancy. We know it's dangerous, but just how dangerous can it be?
So women can contract an infection just like anyone else can while they're pregnant. And if that infection spreads and reaches their uterus, they need some help removing the tissue that is infected, in which case that can sometimes be the fetus itself. Women can also develop sepsis if their water breaks early, like with premature rupture of membranes, or with a cervical dilation early on before viability. Again, you're at a much higher risk of developing sepsis. And so previous to SB 8, it was the standard of care for doctors to intervene in the second trimester if a patient came in with premature rupture of membranes, at least to offer it as an option and to let the mother choose what she wanted to do. Since these laws have passed, though, that's no longer an option, at least according to many hospitals and doctors' interpretation of the law. So instead of offering to provide an abortion and to remove infected tissue, doctors are waiting for women to get very sick. Sepsis is life-threatening. It can affect every organ in the entire body, and it can rapidly lead to death.
And not only that, when you say, affect every organ, affect a woman's ability to have any children in the future, certainly. And the law, the issue with the law doctors are finding is they have to wait until a woman's life, they say, they have to wait until a woman's life is at risk before they could perform an abortion. This is obviously really alarming. You mentioned that you all had to pay for this data. You're actually finding that there isn't much tracking happening on the state or federal level since these bans went into effect about maternal mortality, right?
Not only is there no statewide effort to even understand the health effects of these new laws on pregnant women and pregnant women who are losing pregnancies, who are experiencing miscarriages, but the Maternal Mortality Review Committee has said that it is not going to review mortality data from 2022 and 2023, the first full years after these abortion restrictions took hold, and 2 years in which ProPublica has reported on 3 women who died, potentially preventable deaths, as they were not offered care that might have been offered to them before these laws were put in place. And so those are 120 women who we found, too, who died in hospital in this data between 2022 and 2023, where the Maternal Mortality Review Committee is not going to investigate further and understand what is happening here. What kind of delays are we seeing? What kind of hospital and physician behavior are we seeing that is potentially leading to these deaths?
Such important work that you all are doing, and all are uncovering. Lizzie Presser with ProPublica, we thank you for your time. We know lawmakers have said they're going to look at this session. Of course, we'll be following to see what, if anything, actually gets passed. Lizzie, thank you for your time.
Thank you so much.